Good morning, everyone. Welcome to our Saturday morning practice. We'll be spending the next hour and a half together in what we call the bootcamp, a bootcamp, practicing how to restore our physical health and our emotional health. The two cannot be separated. You can't have one without the other. And so today we rotate every week, and today we're going to be doing the breathing exercise. Breathing exercise in Sanskrit is called pranayama. Prana is one part of the breathing. The other part is called anaprana. And so it's breathing in, breathing out. Yama just means the practice. So that is not very descriptive. The Chinese version is quite descriptive. The Chinese version, the name for that is called tu na. Tu rhymes with the stomach. It also rhymes with when you regurgitate. So it's when you're breathing out. And then na is rhymes with taking in. When you receive, the receival department is called na. So it's very clear that in this case, you're talking about breathing in and breathing out, but using the stomach. The question is, the stomach doesn't know how to breathe. The lung is the one that is breathing. Actually, the lung doesn't know how to breathe neither. It's just a pair of sponges. So what we're talking about is really the muscle between the stomach and the lung, which is the diaphragm. Okay, so we're going to learn to breathe with a lower part of the stomach using the diaphragm. And before we start, we're going to do some warm-up exercise. Warm up in the sense of warming up our body, warming up our joints, and then also warming up our mind by settling our mind onto our body one breath at a time, or a breath, one breath at a time. So I want you to, before we do anything, I want you to be aware of your body. Be aware of the body and learn how to sit properly. Last week I mentioned that someone did a survey of all the different Qigong practice in China. Qi means breathing, or it can actually mean energy. The two words are the same. Again, you cannot have one without the other. And Gong just means practice again, right? So someone did a survey and he says, actually, there's a lot of different ways of practicing Qigong. And they actually thought that there are like 80,000 versions of that. Different villages might have a different way of practicing Qi. And so the simplest way is just sitting in terms of, in a way of enhancing your life energy. Your life energy actually travels in your spine. And so sitting properly can already help in terms of restoring your physical and emotional health. So let's learn how to sit properly. So let's focus on the very bottom of a spine. Let's walk up the spine, one joint at a time towards the top of the head. As we walk up, see if you can stretch the joints. Stretch the joints, one joint at a time as you move up to the top of the head. Stretch your spine as hard as you can, as if you're hanging your spine on the ceiling. Now I want you to lean back, and as you lean back, I want you to feel the lightness in your upper torso, because you're removing your baggage. Your baggage is the weight of your upper torso. And until now, you're supporting your back, your upper torso, with the muscle in the back. As you lean back, you're putting the weight of the upper torso on your spine, as if you're stacking your body one layer at a time. And then I want you to relax. Relax some more. And so this is a very, very effortless way of sitting. Now, many of you do not sit on a yoga mat like I do, but rather you sit on a chair. So I want you to try to move up a little bit, sit on only about 1/3 to 1/2 of the chair, sitting with your butt and not with your thigh. And try not to lean towards the back of the chair. Now, if you must, many of you can have a great time supporting your back. You can put a small pillow right at the lower part of your back, but not the entire back. And then now, I want you to focus on your shoulder. And I want you to lift up that shoulder as far up as you can. as if you're bringing your shoulder to your ears. Now I want you to open that shoulder as if you're squeezing a tennis ball in the back. And then I want you to drop your shoulder and relax. And then relax some more. Now I want you to focus on your forehead. Lean back the forehead. Again, you will feel some lightness because you're not using your neck muscle anymore. You're not using your neck muscle to support the weight of your head, but rather you're putting the weight of the head on top of the spine as if you're putting a bowling ball on top of a bowling stick or of a bamboo stick. Now I want you to take your chin and just kind of tuck it in slightly. So the top of the head is on top of your central nervous system. Now this posture is called the one pillar supporting the sky, with the idea that your spine is now the conduit between the energy that is in your surrounding, between the earth and the heaven. And now this is the proper way to sit. And this is a very simple but very important and effective Qigong practice, practicing the Qi. Now we're going to ready to do some joint exercise. There are 6 joints, 3 in the upper body, 3 in the lower body. The wrist, the elbow, and the shoulder. I want you to feel your wrist, whether it's left or right, doesn't matter. Now I want you to feel your elbow. And then finally, I want you to feel your shoulder. We're going to start to do some joint exercise. So I want you to focus on the center of your palm. And then I want you to bring your hands up very slowly, very mindfully, following the center of your palm all the way up to your shoulder level. Now I want you to turn your wrists, but I want you to turn it very slowly, very mindfully, one turn at a time. Now, a very important part of the practice of Qi is to understand that whether you're talking about breathing or life energy, it's the bridge between your mind and your body. Now, your mind actually, in order to practice, your mind actually has 2 parts. The first part is just intention. The second part is your commitment, meaning that you want to dedicate this session to your body. You want to dedicate this session to restore the health of your body as well as your emotional health. It's a dedication, and the dedication starts with intention. So right now I'm focusing on my wrists, but it's not important. It's not enough that I just focus. I have to commit. So as you turn, in the beginning of the turn, I want you to learn to commit. Bring your mind back to the wrist and then commit yourself all the way from the beginning to the end. Now we're going to turn the other way, one turn at a time. Again, in the beginning, you search, where's my mind? Oh, my mind is somewhere else. Actually, if your mind is not on your wrist, it's very easy to find. It's either in the past or in the future. So I want you to bring it back. Once you bring it back, you commit yourself to this one turn from the beginning to the end. And then when you get to the end, you congratulate yourself, says, that was a good one. Let me do it again. Let me recommit. And I want you to bring your hands down. So focus on the center of your palm, bring it back down. Again, lift up your shoulder as far up as you can. Open the shoulder, lean back. Relax your shoulder, relax your upper torso. We're going from the wrist to the elbow now. So I want you to focus on the center of your palm again. Bring it up. And then turn your elbow. Again, there's a beginning, the end. The beginning is when you commit. And then the end is when you recommit. But your recommitment is only to one turn. You don't have to commit the whole part of what we do here. Just one turn. That's all. It's like recommitting to your breath. We always just one breath at a time. Now I want you to now focus on what happens in the beginning, from the beginning to the end. I want you to focus and try to examine the change in your body. We're going to turn the other way now. I want you to examine the change in your body, see if you're generating any heat, any sweat, any numbness, or maybe even any pain. Whatever it is, just feel it and then let it go and come back. And then now I want you to bring down your hands. We're going from the wrist to the elbow to the shoulder now. So once again, I want you to lift up that shoulder, open the shoulder, lean back, and then relax. Once again, we focus on the center of your palm. This time we're going to cross a hand. We're going to bring up our hands together in front of us, on top of us, and we're going to stretch, pointing the fingers towards the top of the head as hard as we can. Stretch upper torso, stretch the hand. Now, before you come down, I want you to anchor your mind on the center of your palm again. And then you open your shoulder. Feel the pain on the shoulder. Let go of the pain. The pain is gone. It's just the memory of the pain that you're feeling. So I want you to let it go. Come back to the center of your palm. Point as hard up as you can. Open the shoulder. Feel the pain on your shoulder. Let go of the pain. Come back. Bring it back up. Stretch as hard as you can. Open the shoulder. Feel the pain on your shoulder. Let go of the memory of the pain. If you don't let go of the memory of the pain becomes suffering. Stretch as hard as you can. Open the shoulder. Feel the pain on your shoulder. Let go of the pain. We're going to do this 2 more times. Follow the center of your palm. Bring up all the way up. Stretch. Open the shoulder. Let go of the pain. One last time. Bring it up in front of you, on top of you. Stretch. Open the shoulder. Feel the pain on your shoulder. Let go of the pain. Now open it back up. Stretch. And then bring it back down. Open it back up. Stretch. And then bring it back down. Open the shoulder. Stretch. And then bring it back down. 2 more times. Open the shoulder. Stretch. And then bring it back down. Open the shoulder. Stretch. And then bring it back down. Now we're going to do from front to back. So I want you to lift up that shoulder again. Open the shoulder. Lean back. Relax. Focus on the center of your palm. Bring it in front of you. On top of you. Open the shoulder. Feel the pain on your shoulder. Let go of the pain. Come back to the center of your palm. We'll continue. Now the pain is coming, right? So we're going to confront it. We're going to feel it, accept it, and then let it go. Continue. Feel the pain, accept that pain, let go of the pain. 2 more times. Feel the pain, accept that pain, let go of the pain. One last time. Feel the pain, accept that pain, let go of the pain. Sit up straight, all the way to the back. Stretch, bring it down, all the way to the back. Stretch, bring it back down, all the way to the back. Stretch, bring it back down. 2 more times, all the way to the back. Stretch, and then bring it back down, all the way to the back. One last time. Stretch, and then bring it back down. Now, whenever you finish an exercise, whenever you feel that you're under stress, it's very important that you bring yourself back into the rest and digest. All right? When you're under stress, when you're moving your body, when you're doing energetic exercise, your body doesn't know the difference. The body thinks that you're being chased by wild animals. It protects you by shutting down all your most of the biological functions, particularly immunity, digestions, reproduction. It just shuts it all down. So it's very important that you maintain that balance, that whenever you feel that you're under stress, once that is done, you come back and you focus on your breath. So before you focus on your breath, you come back to the sitting posture, you stretch your spine, you lift up your shoulder, you lean back, you relax, you bring your forehead back and then tuck in your chin, and then you focus on your breath. When you move, you focus on your body. When you're stationary, whether you're sitting, lying down, or standing, you focus on your breath. And you just kind of feel your breath. You just said to yourself, I know I'm breathing in. I know I'm breathing out. One breath at a time. So when we talk about emotional harmony, emotional health, the skill that we need to have is how do you bring your mind back into the present? Otherwise, it gets stuck in the past or it's stuck in the future. When you're stuck in the past, very often it creates depression because you're focusing on things that already happened. Either things that are good, that feels good and is gone, right? Or things that didn't feel good, that causes pain, and you're still thinking about the memory of that pain. Or you're stuck in the future on things that hasn't happened yet, and you create anxiety, right? It happens to all animals, including humans. So yesterday I took my son to the airport. He had to fly back to Seattle for a couple of days, and the cats knows that. As soon as he brings out that suitcase, it's ooh, what's going on? I'm being abandoned again. Now keep in mind that this is a animal that has been abandoned once, so she knows. She's experienced that. She's not new to this. In fact, it's very clear that during her last abandonment, she was very hungry. She experienced hunger. So whenever she sees a place that is empty, she gets excited and she wants to make sure that you fill it up with food, even though that she's not hungry. That's just how animal works, and human is just another animal. And right now, she's basically feeling depression. She's thinking like, when is he gonna come back? Is he gonna be gone or what? So it's just very hard. They have this separation set anxiety. It happens to pet. It's very easy to see in a pet. It's not so easy to see in a human, right? So one of the things that we want to do is mindfulness is just that. It's what I call anchoring. It's like you're in the middle of the ocean and a typhoon came and you're not ready, you don't have enough time to get back into a safe harbor. So you go towards the shore but you can't go that far in because then you hit the rock and you sink. And you can't get that far out because then you're in the ocean and the wave would overcome you. So you do an anchor. I talk about the story. I talk about the story how I came to the United States with my family in June 1971 on a boat that took us 3 hours, a diesel boat. As soon as we came, a month later, that same boat caught in a typhoon. So the boat anchored, but the anchor broke. Luckily, there were no passengers, but there were 90 sailors, and all but two were drowned. That's how dangerous these storms are, like emotional storms, right? You get into a storm, you don't know how to get out. Well, anchor your mind on your body, on your breath, right? That's all we do. It's just that simple, right? But it's very difficult to practice. So that's why we have this boot camp, is to practice anchoring your mind. Okay. So in one of the temples that I go, not often, but every once in a while, there's a gentleman that I like very much, my Dharma brother, and he and his wife had worked in the temple as volunteer. His wife works in the kitchen, and the husband works outside helping the elders. And they dedicate their life to that community for decades. I don't know how long. Recently, the wife suffered from dementia and all the other disease, and a month, 2 months ago, she died. And I knew that, and so all along, I've been, I wouldn't use the word mentoring, but kind of being very supportive of the husband. And he knows because my father died from dementia. So often we would talk, and so this is one of the time, if not the only, first time, maybe the first time that we actually have time spent with each other after the passing of his wife. So this is not something I want. I want to tell a joke, but so on the other hand, I said, "Well, why would I tell a joke when I'm talking about the death of my friend's wife?" Well, I told a joke last week, right? And I told you laughing is important. You know why? Because when you laugh, you use the diaphragm, right? So when you laugh like this, it's very good for you. So let me tell a joke, but not to mistaken as disrespect, okay? So the joke is this. So there were a bunch of artists in the village, in the French village, and they want to get together, have a little bit of informal conference, have some coffee, some croissant. And at the same time, a bunch of art critics show up. And so they, of course, gather with their own kind, artists on one side and the critics on the other. The critics were looking at these drawings, this painting, and they were arguing whether that is impressionist and that was modern, or this is postmodern, this is pre-modern. They were having all kinds of discussion exactly where each of the painting belong, which class they belong. The artists were also gathering, having a heated discussions. They were arguing where they can get the cheapest turpentine. So when my friend and I sit down, we were sharing experience, and we were talking about the difference between using a diaper versus a, a diaper that looks like a pair of pants, underwear. And we were talking about how, at first we thought that, we were talking about the importance of both, because in the beginning, my father didn't want to wear diapers, and neither does his wife. That's dignity. So, so you go and you buy this underpants, and okay, I can accept that, and then you kind of help them along, and then pretty soon you realize that they leak, and then so you have no choice. You started putting diapers, and we were talking about how sometimes you have to change diapers 4 or 5 times a day, because sometimes you before, even before you wrap up one, and then realize that they already did that thing, and then now you have to do it again. That's the artist talking about turpentine. It's very painful. It's a very painful experience, but very few people understand that. But why do I say that? Because it is through experience that we understand the difference between pain and suffering. That is very painful to see that your lovers in that state. Is very painful for them. Being a caregiver is a painful process. The smell, the touch, the relentlessness is very painful. But over time, you get to use the skills that you practice. Your whole life is bootcamp. And then eventually you get to use that skill. So here we talk about anchoring a body, a mind on a body, anchoring how do we experience the pain. We create pain on the shoulder, and we said experience it, confront it. And then when the pain is gone, understanding that all is left is just a memory. So accept that memory and then let go of the memory. Don't let the pain metastasize into suffering. And that's what happens when you're a caregiver. Only 2 people who have done that understand that process. That however painful it is, you have to accept it. And then when you accept it, you let it go, because here it comes again. So you might not want to hear that story, but it's real. It's what we do for loved ones. And that's the extreme of your painfulness. When your loved ones die, when that death is a process. And it's not just that you pick up a phone and someone says someone had died, and you miss that person. You actually see it in front of you. It's the process of sickness and death. And that's why what we do. We do what we do for all kinds of reasons. I want to be a better father. I want to be a better son. I want to be a better leader. I want to be a better community member. Everything that you do it better with mindfulness. because you're not enslaved to your emotions anymore. You're able to see things as they happen. And there's a word for that. It's called empathy. Empathy means that you see it, you hear it, but you don't try to change it. Our practice is not to change other people. Our practice is how we change ourselves. Maybe I cannot change this body. I'm going to be 70 years old. There's nothing I can do to make it younger. I just maybe make it slow down the aging process. I'm not going to try and change that. I'm just going to change my perception of it, how I live with it. So what we do here is just how to change our way of life by changing our way of seeing life, not to change others. Okay? All right, so we continue. So I want to tell you how important that joint practice is. Now, this is actually one of the 4 foundations of mindfulness, the foundation of sensation. Feel it, but don't judge it. In other words, I feel it, I accept it, and then I just let it go. I don't become it. Okay? This is one of the most important foundation. All right, so we're going to continue, right? I noticed that no one sends me heart because you're listening. Or either that, you said this is too much. I don't need all that. But that's good. That's good. Is when you're listening. I can see that you're listening. All right. So lift up our shoulder, open the shoulder, lean back. Thank you. I see it now. I see the heart now. That's enough. Come on. Let's go. Let's stay focused. All right. So put your left hand in front, put your right hand. Now, this is actually a Qigong practice, right? And it's the practice in your mind, understanding the difference between your left brain and your right brain. One is emotional, one is rational. And oftentimes, you let things go by switching the sides of your brain. If it's emotional pain, you try to deal with it rationally, and vice versa. So this is a practice. So sit up straight, stretching the right hand, focusing on the right side or on the center of the right palm, using your left brain. Bring it across mindfully, anchoring a mind on the center of your palm. Now you know the pain is coming, so let's confront the pain. We're not hiding away from it. We're going to confront it. We're going to feel it, and then the pain is gone. What's left is just a memory. So accept it, and then just switch the brain from the left to the right, and then the other way. Feel it, accept it, and then let it go. Right side. Feel it, accept it, and then let it go. The other side. Feel it, accept it, and then let it go. Right side. Feel the pain, accept that pain, let go of the pain. Sit up straight. Feel the pain, accept that pain, let go of the pain. 2 more times. Right hand. Feel it, accept it, and then let it go. 1 last time. All the way around. Feel the pain, accept that pain, and then let go of the pain. Now, focus on your breath. Restore that harmony between yin and yang. Yin is away from the sun. When you're inside the cave, that's yin. Yang is when you're outside in the sun. When you're inside the cave, that's rest and digest. When you're outside the cave, that's fight or flight. And so when you say yin and yang, we're really talking about the 2 autonomous nerve systems, the sympathetic and the parasympathetic. So as soon as you do an exercise that creates that stress state, you come back and release the stress by focusing on your breath, 1 breath at a time. Okay? All right, so that's one of the 3 exercises that we do before we meditate. So that, and then all this one in front of that is the basically focusing on your sensation. Understanding that sensation is when your hand touches an object, when your eye sees light, when you hear a sound, when you smell, or when you taste. It's really just the nerve ending collecting signal, creating electrical signal, and then it runs along your nerve and it comes into your spine. That's it, right? Just a sensation. You haven't really judged it yet. You haven't made any, whether you decided that it's good or bad yet. You decide it's good or bad when all the signal collects into your spine and then goes in your brain, your thinking brain, okay? So what we're trying to do is we try to prevent that from going to the head by just letting it go, right? Because that's just the memory that goes up. All right, so let's do another exercise. And the next two allows us to be more focused when we meditate. And the first one is really creating more energy, more blood flow. And then the second one puts us back into the rest and digest by activating the vagus nerve. Okay, so let's do the first one, which is what we call throwing the fist. So again, you lift up your shoulder, you lean back, you open, and then you relax. You bring up your right hand, you focus on the center of your palm, you make a soft fist, you follow the fist, go up, feel the vibration coming back to your shoulder. Now the left hand, up, come back, down, sit up straight, down, up, up, down, down. One more time, up, up, down, down. Open your shoulder, follow two hands. One, feel the vibration. Two, three, four, and five. All right. So this is basically Newton's second law: action equal to reaction. Sending energy out, that's yang, and then receiving the reaction of that is yin. Okay. All right. So now let's focus again. Bring one breath at a time. And the last exercise activates the vagus nerve from the back of the ear down the neck, all the way in. It connects everything inside the internal, and particularly the diaphragm. Okay, so it requires the movement of the shoulder, movement of the neck, movement of the back, as well as deep breathing to activate the diaphragm. All right, the entire vagus nerve. All right, so lift up a shoulder again, open the shoulder, and then relax. Now, I talk about Qi and two ways of interpreting Qi. They're actually one and the same in the end. But one is breathing, and the other one is life energy that runs in your body. And so, with understanding that Qi is the bridge between your mind and your body. The mind is both the anchoring part and also the what we call the diligence part, right? So it's not important that you just focus on your body, but you focus on your body continuously, right? All right. So, but then understanding the breathing is just a bridge, all right? So I'm going to talk about this by trying to explain that your focus ought to be on your breath and not on your body. Let the body follow, okay? All right, let's try to do that. It sounds very complicated. It just needs practice. It's just like back in the days when I started learning how to drive, the teacher said, put your hand on the 11 o'clock and put your hand over here, and then we'll look at your mirror on the side, and it's so complicated. But then it becomes muscle memory, right? Okay, so lift up your shoulder, open your shoulder, lean back, and then relax. Now take your hand, use your thumb as a pivot. So just kind of put it on your shoulder. And as you move, right, this becomes your pivot. Now bring up your fingers, okay, gently. Don't have to hold it very tight because you don't want to be under stress. Now I want you to focus on your elbow. And I want you to bring up your elbow, the entire body going up, bringing your shoulder to your ears. That's one. Now, point your elbows back. As you point your elbow back, you open your shoulder as if you're squeezing a tennis ball in the back. That's two. Now, point your elbow down, relax. That's three. And then point your elbow forward, looking down. Now, from four, we go to one. Bring your elbow up, looking the point, the head. We're looking straight ahead, but you close your eye, okay? And then you open your shoulder. Now, we're as if we're looking at the ceiling, and then we bring it back down. And then finally, we relax with the elbow pointing forward. Now, we're going to coordinate that with the breathing. So as you bring it up, I want you to breathe in, all the way in. And then as you point your elbow down, I want you to breathe out, all the way out. Now, the trick is understanding that the breath is your bridge between your body and your mind. So focus on make sure your mind is on your elbow. That's one. And now focus on your breath. Let the body follow, okay? Breathe in, breathe out. Focus on let the body follow, right? From the mind to the breath, and then from the breath to the body. Breathe out, breathe in, breathe out. Very often we focus on the body first and forget that this is in reality a breathing exercise. So focus on the breath. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Two more times, okay? Breathe in, breathe out. One last time. Breathe in, breathe out. Okay? Relax. So, a lot of times our anxiety and our depression comes from really expectation, right? Come from expectation. Just what you're expected to do, starting from your parents, from your peer, ultimately from yourself, right? You're living under the pressure of all these expectations. But keep in mind that the expectation, by definition, is what other people can see or what you can see when you look at the mirror. So the expectation is stretched on the body. So when you're talking about Qigong practice, it's really bringing...
Well, I'm not a doctor. If you have a wound that might need stitches,
okay,
you should seek medical attention.
All right, thank you.
A healthcare professional can properly evaluate...
Serious. I want to be part of this. So it's just expectation. So really what we're talking about now is shifting the expectation from the external to something that is a little bit more internal. So when I practice, I have a lot of expectation. I do have a lot of expectation, but it's not how I look. It's not how I look in front of you. It's not how I look in the mirror. It's how I feel internally. So Qi practice in a way is taking that emphasis on your physicality and bringing it little by little back into your spirituality, using the Qi as a bridge. Okay, so when you do this exercise, sometimes it's important to remind yourself that it's the Qi that I want to focus on. It's the breathing that I want to focus on, and just let your body follow. Right, and don't worry. Like, am I doing this right? Am I doing it exactly like Danny is doing? It doesn't matter. I don't even know what Danny's doing because I don't see him. I see what's inside of Danny. Right? That that's that's what we do here. All right, seeing the totality of who we are, not what other people see us. All right. So let's focus on our breath now. So before we do anything, it's important that we once again come back to our body, examine our body. The sitting posture we call sit like the bell, like the Liberty Bell. So the legs are the pedestal. So if you sit on a chair, which is fine, and if you could, you move up a little so you're not putting pressure on your thigh, and you sit with your butt But if you have to, it's okay too. Just lean back and be comfortable. All right. And if you sit like I do on a yoga mat, then try not to use any leg muscle. Try to put pillows and blankets to support yourself. Or if you do what I do, which is just lay it flat on the yoga mat, that's fine too. That would be good. Now, many of you are accustomed to doing hand gesture. I would suggest that you don't do it right now. Let go of it. And just rest your hand on your thigh, on your knee, on your calf, wherever. Just relax, not using any hand muscle. Now comes to the spine. Going back to what I said in the beginning of the class, stretch your spine towards the ceiling as if you're hanging the clapper inside your bell, which is your spine, onto the ceiling. And then lean back so that the spine is actually in the center of the bell and not leaning forward or leaning back. And then relax. Now lift up your shoulder, open your shoulder, relax. Lean back your forehead, tuck in your chin. And then finally, we come to the eyelid. So we say, shut your eyelid, close your eyelid, but don't shut it as if the eyelids are the drapes or the window. Just lower the drape. So you might see some light coming in. You might even see your knee, the tip of your nose. It doesn't matter. Just relax. And then finally is the tip of the tongue. Now there's many, many reasons why we put the tip of the tongue behind the teeth, where the teeth meets the roof of your mouth. One is that it activates the salivary gland. The only way that the salivary gland would be activated is if you are in rest and digest. Two, any saliva that you generate, which are from inside of your tongue, controlled only by the small brain, now flows into your stomach and not into your lungs, so you don't choke on that. Three is actually an important conductive path. We'll explain in a minute. So first, we're going to focus on the belly button. Actually, more accurately, we focus on an energy point that is about 2 fingers below, called the Sea of Qi. The Chinese believe that this is the energy point where you receive the restorative energy from your mother when you're inside her womb. So I want to focus on that. And now we're going to examine our breathing. Feel that you're breathing in ever so slightly. Feel that you're breathing out. Now we're going to focus on that energy point below the belly button called the Sea of Qi. And when we know that we're breathing in, try to relax your stomach as if you're bringing the Sea of Qi forward. Now, I don't want you to be stressful. I just want you to feel your stomach and use your mind as if you're bringing the belly button forward. Okay? You don't actually have to do it. Just think it. And then the body would follow. And when you breathe out, just imagine taking that belly button and bring it back, all the way back. On the other side of the spine, there's an location, exact location. We call that the gate of life. So these two energy points, when you breathe in, you move it forward. When you breathe out, you bring it back as if you're bringing the two energy points together. Now, I never said that this is going to be easy, but I don't want you to make it worse by stressing out on this. Just relax. Nobody's watching you. There's no expectation here. Nobody can even see the difference in your body. They have no idea what you're doing. This is all inside of you. So when you breathe in, relax your stomach, pointing the belly button forward. When you breathe out, bringing the stomach one breath at a time. Now, if you have an Apple Watch, you're the lucky bunch because there's a function called mindfulness, and inside there's a function called breath. And you set it, and it does something very simple. It just vibrates, and you see a little circle that opens, and you just feel the vibration on your wrist and follow the vibration, breathe in, and then breathe out. I'm not an Apple Watch salesman, right? I don't. But I think other watch, if it's as I believe that part of our aging requires more instrumentations anyway. So if you could find a way to get a watch of some kind, that smartwatch, it actually can help. You can measure a lot of biological functions, including your sleep pattern. It's something that, and I think there are some insurance company that will reimburse you, but I'm not 100% sure. Okay, now the next thing we do, this is something you need to practice at home, right? So the next thing we do, once we get it going, understand the rhythm of a breath, learning how to focus on it. Then the next thing we do is we start to focus on the bottom of our spine. And as we breathe in, we walk up the spine, we stretch the spine until we get to the top of the head. And as we breathe out, we lean back and then relax, coming back down to the belly button, passing through a tongue. Breathe in, stretch, breathe out, lean back and relax. Okay, so let's sit for a little while. I want to do some stretching exercise with you. All right, and then before we go down to the floor, let's just sit for 5 minutes, breathing in, breathing out. Now this technique ultimately is going to be called the wandering dragon chasing the pearl. Right, focusing on your breath. Over time, after practice, after much effort, you actually feel some energy rising on your spine as you breathe in. We call that the pearl. And this is the time when you need to follow the pearl. So you become the dragon chasing after the pearl. But understanding that this is a wandering dragon, the reason we say that is that this chi, when it goes from just the breath to life energy, is actually the life energy in the universe, just happened to pass through you. So it's like you're having magnetic resonance with the universe. So in this case, when you feel the energy rising on your spine, you don't stop at the top of the head. You want to return that energy back to the universe. So you let it go as high up as you can, as if the dragon is returning to his ancestral home. And it's only when you breathe out that you come back down and then relax. Okay, I'm going to do some stretch exercise, all right? So, because last week someone says, oh, if I want to do this at home, which one should I do? You do the one that just comes to your mind. It doesn't need to be one or two things. It's, whatever you want to do is fine. Because they're all kind of doing the same thing, which is to create the chi and and then create that balance, the harmony in your body. You could just stand, right? Sit, stand, all that would work. Or you can just use YouTube and you stop and then you pick it up the next day, right? It will come back. Now, so this simple exercise of breathing with your stomach, opening your stomach when you breathe in, closing the stomach when you breathe out, and then also circling the around the spine actually has proven to be to have a lot of uh, 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 health benefit, right? So when you breathe with your diaphragm, it actually puts your body into the sympathetic mode, fight or flight mode when you breathe in, and then it puts you back into the parasympathetic mode, the rest and digest when you breathe out. And you can actually measure that. Even the Apple Watch will measure that. It's called heart rate variability. When you breathe in, you go into the fight or flight, your heart rate goes up. When you breathe out, you relax, your heart rate goes down. That difference is actually an indication of your health. It's an indication of your health. And there's been a lot of studies that shows that it slows down your inflammation, right? Including dementia and everything. And then also circulating back and forth also has a lot of tremendous benefit. Okay, so let's do some stretching, right? As we age, I keep saying as we age, some of you might not be aging yet, or you haven't recognized it. And that's because I have this self-centered view of the world. I was born in 1956, and if you look at the 1956, it's right in the middle of the baby boomer. And so anyone who's 10 years or so older than me, they're in the beginning of the baby boomer. Anybody who's 10 years or so younger than me, they're at the end of the baby boomer. That is actually um, a majority of who we are, population-wise. So I just, I'm very self-centered that way and focus on that. And so, uh, when I say as we age, that's what I meant. Okay, as we age, one of the things that we want to do is we want to increase our yang energy. Yang energy. Yang is actually a life energy, right? So what happens when you don't have yang energy? Well, you get tired very easily. You just don't have it. Right? It's like the furnace in the train. You're not burning anything. There's no energy in you. And the other one, so not having energy is what we call yang deficiency. And when you go to bed and your feet are very cold, or even, I see people in the temple, wraps around in big old thick winter coat because they are cold, you know. So that's indication of yang deficiency. So what we're going to do is do some stretching, particularly the meridians that are in the back facing the sun, of course the spine, but also the what we call the triple warmer, which is on the outside of the arm, and also what comes on the side. Okay, so we're going to do 3 deep breaths as we do our stretching. Open your shoulder, lean back, relax, taking our hands, locking the fingers, palm facing up. Now we're going to take a deep breath from the belly button all the way to the nose, okay? But just follow the hand, taking a deep breath in, breathe in. Now flip your hand, follow your hand, breathe out. Lock your elbow, looking straight ahead, okay? Now imagine you have 2 big rocks on the side. You're going to do some rock climbing and pointing the center of the palm outward and climb on top of that rock. And then relax. Second time, breathe in, breathe out. Lock your elbow, looking straight ahead, pointing the center of the palm outward and climb on top of that rock. Back again. One last time, breathe in. Lift up your body as you breathe in, and then breathe out, following the center of your palm, looking straight ahead. Climb that mountain, and then back. Hands lock, palm facing up, flip, palm facing down, push gently, lock your elbow, looking straight ahead, bringing your hands up in front of you, on top of you. Lean back so you're forming a straight line between the bottom of your spine, the top of your head, and the center of your palm, and you push as hard as you can, stretch as hard as you can. Now, and lean back, stretch your spine slightly towards the back. Come back to the middle and stretch again. Lean all the way to the left. putting some stretch on your spine, and then come back to the middle and push. Lean all the way to the right. Come back to the middle and push all the way to the left. Come back to the middle and push all the way to the right. Come back and then relax. Back to the shoulder, lift up the shoulder, open your shoulder, lean back, relax. Now taking your right hand, putting the palm on the left shoulder, lean back. So you're putting stretch on the right shoulder. You take the left hand, you grab your right elbow, you sit up straight and you stretch your spine towards the left. You come back, looking straight ahead, and then grab your left elbow and stretch to the right. And then come back, focusing on a breath. One breath at a time. I know I'm breathing in. I know I'm breathing out. Giving yourself plenty of time to restore the harmony between your autonomous nervous system. Now open your shoulder, lean back, and then relax. Taking your left hand, palm facing up. Taking your right hand, put that between the fingers and the palm. You bring down your left hand, you focus on your left elbow, and you push your elbow, you lock your elbow, you're looking straight ahead. You bring up your left hand, palm facing forward. Without turning your upper torso, you're taking your left hand and you stretch it to the right, locking your elbow. You bring it back, you relax. Now you take your right hand, you sit up straight, palm facing up. You bring it down, focus on your elbow, push, lock, and then looking straight ahead, bring it up. Without turning your upper torso, you take your right hand, you stretch it to the left. Bring it back, and then relax. Back to the breath. I know I'm breathing in. I know I'm breathing out. Now open the shoulder, lean back, relax. Taking the right hand, palm facing up. Taking the left hand, palm facing down. Open the shoulder, wrist at 90 degrees. Now focus on the right palm, the center of your right palm. You push as if you're pushing the sky up until you lock your elbow, wrist at 90 degrees. Now you take your left hand, you push down and as if you're pushing the earth down. Lock your elbow, wrist at 90 degrees. Now you take your right hand, you bring it back slightly, and you turn to the left until you stop at the shoulder. You keep turning your eyeball as if you're looking at your back, stretching the tendon behind your eye, and then you're bringing everything back, and then you relax. You turn to the other way, open the shoulder, wrist at 90 degrees. You push as if you're pushing the sky up. Right hand, you push as if you're bringing the earth down. You bring your left arm back. You rotate to the right. You stop at the shoulder. You keep turning your eyeball to the back. You bring everything back, and then you relax. Okay? All right. So now we stretch our spine. All right? Sit up straight, open the shoulder, lean back, relax. Taking your two hands, lock the fingers, palm facing up, palm facing down. Slightly push down until you lock your elbow. Now you focus on the top of your head and the center of your palm at the same time. You push your hand down, you lift up your head, one up, one down, you stretch your spine, and then relax. And you lean back slightly, looking at the ceiling, 45 degrees, and you bring your hand up. And then relax. Come back, focusing on your breath. Open that shoulder again, lean back, relax. Taking your right hand, put that on your spine, lift up, so you're looking straight ahead, and then focus on your right shoulder and bring your shoulder up. And then relax. Taking the other hand, looking straight ahead, and you bring your left shoulder up. And then relax. Back to the breath. I know I'm breathing in. I know I'm breathing out. Open the shoulder again, sit up straight. Right hand, palm at the lower back, two fingers pointing the left shoulder. Bring your right shoulder down and your fingers up. And then relax. Do the other side. Looking straight ahead, bring your left shoulder down and your fingers up. Now take two hands, looking straight ahead, right shoulder up, left shoulder down, and then relax. Do it the other way. looking straight ahead, left shoulder up, right shoulder down, and then back to the breath, one breath at a time. And I know I'm breathing in. You notice that as soon as you pay attention to your breath slows down. Your breath slows down means that your mind slows down. Your mind slows down, meaning that you return to the rest and digest. When you return to the rest and digest, you're restoring your sensitivity to your own steroid, what's called cortisol. A big part of a health problem is because we develop what's called cortisol resistance. We don't know how to bring it back. So we're always under stress, and over time, we lose our own self-healing power. The cortisol is to reduce inflammation. Okay, now one last exercise, stretching exercise called the reverse Buddha. Open your shoulder, lean back, relax. Taking your two hands, joining the palm, fingers pointing down, looking straight ahead, fingers pointing up. Bring it up. Try to put the palms together, looking straight ahead. Now, open the shoulder and push your palm forward. And then relax back to the breath. Okay, so this set of stretch exercise mainly work on your meridians to increase your yang power, right? Yang energy. Okay, all right. So now we're ready to do what we came here to do, which is to learn how to breathe. Learn how to breathe properly. Okay. Okay. All right. But before we do that, we got to work on some joints, right? We got to work on the lower part of the body. So the wrist is like the knee, the heel, the elbow is like the knee, and the shoulder is like the hip. So we got to work on that. So let's work on the knee mindfully. 1, 2, 3, 4, and 5. The other way. 1, 2, 3, 4, and 5. Now to the heel. Okay, right heel first. 1, 2, 3, 4, and 5. The other way. 1, 2, 3, 4, and 5. Now to the left. 1, 2, 3, 4, 5. The other way. 1, 2, 3, 4, 5. Okay. Now we're going to do some balancing exercise. Now it's important that we do stretching. It's important that we exercise the muscle. It's important that we do things that are cardio, exercising the heart and the lung. And then finally, it's important that we do some balancing exercise. Balancing requires the workings, the separation between the left brain and the right brain, right? And so maintaining that separation is what is the key to prevent dementia. So balancing exercise is very important. So first, we're going to stand on the toes. Now the key is to lock your eyes in front and just stand on your toes, focusing on top of your head. And then when you come down, impact your heel gently. Second time. And then one last time. And then down. Now we're going to stand on one foot. So I want you to lean to the left, putting all your weight on the left foot, and then focus on the right foot, focus on the heel. Bring up your right foot and go 1. Looking straight ahead. 2. And 3. Okay? Now we stand on the right. Okay? I do better on the right because I'm left-brained. That's my logical brain. I'm not an artist. I'm an engineer. Right? Now focus on the side. Bring up your left foot. 1. Oops. 2. Speak too fast. 3. Okay. Now finally to the hip. The hip is very important. So focus on the hip. This is what is the only thing that restores your balance when you fall. Okay. Now stand on your right. Put your hands in front. Bring it to your left. Notice that the toes are up, so you actually pivot on the heel. and form a straight line between your heel, your knee, your hip, and your shoulder, and turn. Don't stop. Go all the way to the end, and then turn some more. And then forward, relax. Second time, turn. Don't stop, and then relax. One last time, turn. Turn on your left hip, forward, and relax, okay? On the other side, turn. Forward, relax. Turn. Forward, relax. One last time, turn. Forward, and then relax, okay? All right, so now we're ready to go. Now, in the beginning, is mainly about practicing on your mindfulness, right? So I call this mindfulness in motion. Pay attention to your body. Focus on the center of your palm. Bring it up. Bring it towards yourself. Bring it back down. Lower your knee, and then stand back up. Relax. As you bring in your hand, you take a deep breath in, all the way in, and then you take a deep breath out using your nose. Okay, but don't force it. Don't force it. Just let it go. Very simple. Breathe out. Breathe in. Very mindfully. Breathe out. Cross your hand. Bring it high enough so you can see it. As you open, you can see it with the corner of your eye. Breathe out. Breathe in. Breathe out. In. Out. In. Out. One last time. In. Out. Breathe in. Breathe out. Now we're going to do 1 minute of standing meditation, right? You can meditate when you sit, when you stand, when you lie down, when you walk, or when you exercise. When we sit like the bell. When we stand like the pine tree. So let's move our feet around, grow some roots, loosening up a knee if you can, opening your shoulder, close your eye, and then just focus on your breath, one breath at a time. I know I'm breathing in. I know I'm breathing out. Okay. Now, standing is actually a very important Qigong exercise or exercise in general. Because what you're doing, especially when you're loosening up your knee, is you're activating your calf. Your calf is your second heart. It increases the energy flow in you. Okay? So there are people who practice just that as martial art. It's called Jam Zhong, right? So some of you actually know that. It remind me of that. Jam means stand. Now, what does Zhong mean? So when you go to Venice, all the things are built on water, and so foundation is a beam, is a stilt that they push into the mud. That's what it meant. So you stand. So it's as if this is what's supporting your body, loosening your knee, and just that, right? So this turned out to be an exercise that my master taught to someone who was suffering from Parkinson, and because he can't exercise anymore, so he just said, you stand, loosening up your knee, hold on to your stroller, and it actually is a good exercise. So just that, okay? All right, now the next one is called balloon breathing. So we lean back, toes pointing up, we're looking at the ceiling, we bring our hands high enough so I can see with the corner of my eye, and then now without bending, You just roll your body forward. Heel is up. You embrace yourself. You're looking at the floor. You open back up, looking at the ceiling. As you roll forward, you breathe in. As you open, you breathe out. You're actually exercising your diaphragm without knowing. Now, but the key here is not to focus on your body, but focusing on your breath. Let the body follow. Remember what I said, that the breath is the bridge between your mind and your body. So your mind is following the center of your palm. Now just focus on your breath. Let the body follow. Don't judge your body, okay? Judge your breath. I'm breathing in. I'm breathing out. In. Now the key is you pay attention to your breath, breathing out. You breathe out as much as you can, and then just let your body breathe in on its own. Otherwise, you get hyperventilated, okay? Breathe out, and then breathe in, okay? All right, come back. Standing position, 1 minute. Yeah, to the left, get ready. Breathe in, and then breathe out, all the way out, focusing on the breath, not the body. Let the body follow. Breathe in, relax, and then breathe out. Let the body breathe in on its own, and then breathe out. Relax, breathe out. In, out, in, out. One last time. Follow the hand, breathing in. Follow the hand, breathing out. Okay? Now lower your hand. Come back to the standing, focusing on your breath, one breath at a time. Whisper to yourself, I know I'm breathing in. I know I'm breathing out. Okay? Whispering is very, very important. Whispering is a very powerful therapeutic technique. You whisper to your kid, you whisper to your pet. Why don't you whisper to yourself? You even whisper to the dead. Whisper to yourself. Okay? Very important. All right. So now, butterfly. Lift up your hand, looking straight ahead. Bring the hands down, lower your knee, straight down, okay? Bring it back up, raise your heel, looking straight ahead, focusing on the center of your palm until you bring the back of the hand together. As you come down, you breathe in, As you go up, you breathe out all the way out, focusing on the breath. Remember what I said? The breath is the bridge. Breathe out, breathe in, breathe out. In, out. One last time. Breathing in, breathing out. Now bring your hands down, lower your heel, back to standing, and once again, whisper to yourself. I know I'm breathing in. I know I'm breathing out. Okay? Learn to whisper to yourself. After class, I have to whisper to the cat. I can hear her. You grab her really tight. She likes it. My hand gently holding her the neck, and just whisper to herself. Get her out of that anxiety, the separation anxiety. A person can be anxious and depressed at the same time. So can a cat. Now the next one is called pushing hand. So it looks a lot like Tai Chi. That's right. That's why we use all 6 joints. That's why we focus on our breath. I see a water wheel in front of me. I focus on my hand. I bring it in front of the water wheel, on top of the water wheel, and I bring it all the way down, lower my left knee, and I bring my hand to my hip. And then I see the center of the water wheel, and I push gently. As I bring up, I breathe in. I open my shoulder. I bring my hand to the hip, and I breathe out, pushing forward. Breathe in, breathe out. In, out. Very gently, very mindfully, focusing on the breath. Let the body follow. Don't judge your body. Okay, don't judge your body. Breathe in, breathe out. In, out. In, very slow, very gently. Breathing out. One last time. In, out. Come back. Okay. All these exercises are very therapeutic because you're focusing on the present. You're not thinking about the past. You're not thinking about the future. The past is the past. You learn enough from it. Let it go. The future change all the time. It'll be a different story when you get there. So now to the left. Get ready. See the water wheel in front of you? Yeah. Follow that water wheel. Go up all the way to the top, all the way down, and then see the center? Push. Breathing in, Breathing out. In, out. One breath at a time. Out. Breathing in, breathing out. One last time. In, open that shoulder. Feel the strength in your back. And then breathing out. Come back. Okay? So, without even knowing it, you're using the diaphragm and you're cycling between fight or flight when you breathe in and rest and digest when you breathe out, maintaining that harmony between your autonomous nervous system. Okay? Healing yourself. Stop talking. Okay? Now the final one is called up and down. Get ready. Open your shoulder, looking straight ahead. Breathing in. And then open your knee. Go down as you breathe out. And then when you get to the bottom, push forward. And then breathe in again. All the way in. When you come to the top, you bend back. And then relax. All this time exercising your adrenal gland. Okay? Get ready. Breathe out. Breathe in. And then relax. One last time. Breathe out. Breathe in. And then relax. Okay. There's a symptom. There's a state of aging called adrenal fatigue. So what happens is that you're under stress all this time, creating high blood pressure, and the doctor gives you high blood pressure medicine without really explaining, without even exploring. Forget about explaining, without you exploring the source of your high blood pressure. And in most of the time, it's just that you're under stress all the time. You're releasing stress hormone, and then eventually you get to a point where your adrenal gland just gave up, and that is when you feel lightheadedness. Lightheadedness. So the Western doctors knows that. So they would, when you go in the examining room, they don't ask you to lie down, right? They just ask you to sit on the chair, on the edge of the chair. And then they get you to lie down, and then they get you to get up just to see if you have lightheadedness. And when you have lightheadedness, it's because you're not releasing stress hormone in time, right? So this exercise is a very good one. All right. So I want you to just meditate on your own, and then I'll tell you more story. So, I talk about not thinking about the past too much. I should not say not thinking. I should say just not overthinking, right? Of course, we think about past. Of course, we think about everything that happens in the past. That's who we are. Just don't overthink it. There's time to let go. Just let it go, right? Just let it go and don't overthink it. So I also talk about don't overthink the future. Don't overthink the future. When I really learned to not overthink the future is when I ran my own company. And I had two companies. The first one was not successful. I lost a lot of money for other investors. The second one was good. The second one. And the difference was that I went from being an engineer in the first company to being a salesman in the second company. And I was so much into sales and so dedicated sales and so much that I want to avoid being a technical person that by the time I sold my second company, I didn't know how to use my own product. I didn't want to learn. I know what it's supposed to do, and that was enough. And instead, I focused on the customer, listening to the customer. And that's when you know that you don't want to overthink the future, because the customer will tell you what they want. And all you have to do is listen. So there's no reason to overthink the future, because everything changed. The person who decides the future is not even you. There's a great story about how to sell. And it comes from a time in China where there were 3 separate small kingdoms all fighting to unite China and become the supreme leader, supreme emperor. But of course, in the end, all 3 fail, and someone else emerged and become the next, the leader of the next dynasty. But the point is, one of the kingdom, which is the weaker one, was retreating. This is a time when they were frenemy, they were friends and enemy at the same time, because there's 3 of them. They often have to gang up to fight one, and then change alliance and fight the other. So the weak one had to retreat, and they had to retreat through the territory of the second kingdom, because they were both fighting for the third at the time. And so the king of this retreating kingdom had a advisor who was basically the salesman for his enterprise. And they talk about how to borrow passage from this other king. And this, actually, he was the prime minister too. And he was tasked for going over, being the emissary to ask for passage. So the evening is a tough one. It's a tough evening waiting for the audience in the morning. Everybody's anxious, because if they cannot retreat, they're gonna die. Right? And so the emperor was in his tent. He looks over and he sees the tent of the prime minister, and it was completely dark. And the emperor's, the king, actually the king, it wasn't an emperor yet, was going like, what the heck? Shouldn't he be thinking about what he should say in the morning? Because, tomorrow's such an important day. It's a life and death day. So he couldn't help it. So he walked over to his tent, and his prime minister was sleeping, snoring. What? He said, that's not right. He's not taking it seriously. So he wake him up, and he says, what are you doing? You had a great important decision, important task for tomorrow. Shouldn't you be strategizing? And the prime minister looked at the king and says, we know what we want, right? We just don't know what the other guy wants. So let him speak. Let's go to sleep. That's how you should deal with future. You know what you want. Just sleep on it. Stop talking. Stop thinking. Let the future come to you. Because it just creates anxiety. That's it. Right? Okay? All right. So with that, we close out today's class. Someone says that they enjoyed last week's service talks. Was that about the driver and the chauffeur? I want you to know that all my jokes are Israeli jokes. Back in the days when I was teaching at UCLA, I had colleagues from Israel, and they tell these stupid jokes. They were so funny. I remember every one of them. All right, so let's put our hands together. Let's work on some building blocks for meta meditation. And the most important building block is the one about gratitude. I told you about my friend and I who had shared experience about taking care of loved ones who were suffering from dementia. And all the things that we talked about, the one thing that we agree on was that we go through the entire ordeal being very grateful. Being very grateful for the companionship of a loved one. I for my father, he for his wife. So I want you to remember that. In the worst of time, try to find the strength to be grateful. To be grateful for yourself, to be grateful for you who you are, to be grateful for your health, and to be grateful for your integrity. Now think about your family, whether they're your parents, your spouse, your offsprings, or your siblings. They're all there for a reason. They're there to support you, or not, but they're there. And they make you a better person. Now, going outside the home, think about all your neighbors. Some of them are good neighbors, some of them not so much. But you know what? When something happened in the neighborhood, they will come to you and they will ring your bell and say something like, your house next door is on fire, better get out. Just that simple. Or they will be there guiding the ambulance when your loved one needs help. They will be there when you need them. Be grateful to them. Be grateful to your community. Be grateful to all the people who are first responders in your city. In San Francisco, you can be an ambulance driver, you can be a nurse, you can even be a doctor, and you cannot afford to live in the city. But they're here anyway. Of course, they're here to work, to make a living. There's nothing wrong with making a living. They have kids just like you do. They have to support their family too. But they choose this profession because they have a heart of kindness. Be grateful to them. Be grateful to people you meet who are willing to give you a lending hand, whether they're your teacher or they're your peers, or they might even be your subordinates. Be very grateful. This is the most important building block, is being very grateful. The second building block is to accept. The most important is the person that you need to learn to accept is yourself. When you look at the past, you think about all the things that you didn't do well, you didn't do enough, or you did wrong. But that's who you are. You did the best you could. It's time to accept that. When you look at the future, you're anxious that maybe you don't have what it takes to do what you want to do. But you have to accept that too. You're going to do the best you can. Learning to accept yourself allows you to learn to accept others. In your process, you might have hurt someone that you didn't mean to. And maybe the person who helps you also didn't mean to. It's time to accept that. And with that, we get to share. We don't always just share with money. That's the least valuable that you can share. It's important that we share our time together. And I want you to share with all the beings in this world. They could be human beings, and they could be other beings. Particularly those who die in wars. We have so many wars going on right now. We have so many famines going on right now. We have so many places that is over 100 degrees. Humans can hide inside air conditioning room. What about the animals? How do they survive? There's so much suffering in this world. And I want you to share your positive energy with them and hope that someday they could be released of the physical suffering. Someday they could be released from the spiritual suffering. And then they could continue to be protected by compassion, loving kindness, empathy. May we all be blessed with health, with happiness, and with peace. Namaste. Okay, all right. Okay, 星期一見，拜拜。多謝 Billy 師兄。好，多謝大家。OK，拜拜。拜拜。